3, 2.
Okay, so in this video, I am going to go over some of the pediatric equipment that we're going to use so that you can do your assessment and obtain vitals on infants. So again, I have our younger infant here in the bassinet. So I'm going to kind of show you the pieces of equipment because some of them are a little bit different than what you've used in the adult world. Temperature probes, you're going to have the same that you've been using in the hospital and the ones that are in our simulation lab. However, when you use this equipment, there are settings to adjust for pediatric patients for your infants. So once you take the temperature probe out and we put on our cover, once it comes on, the default is to an adult oral setting. But if you press this little button with the person on it, click once and it goes to adult axillary, but if you click twice, it goes to infant. So you can see the little guy crawling on the ground. So that's your infant axillary. So that's what we'll be using in pediatrics. Now you may hear in 313, you may talk a little bit about rectal temperatures. On Peds, on our units that we are going to be going to for clinical, we do not do rectal temperature assessment unless it's an order. So if we have a hypothermic baby and they have an order placed for a rectal temperature, then that's what we would do. But the general on the floor, we're going to do axillary temps until the child is old enough to do an oral temperature on their own. So we would adjust your setting here for that equipment. The other piece of equipment that's going to look a bit different is the pulse ox probe, okay? So this, I have it on a mobile monitor, but this would be coming from the room monitor. So here, in adults, you usually have the finger probe that clips on. In the pediatric units, we're not going to use this. We're going to use this type of a probe. So a couple things you'll want to see. This is sort of like a stretchy, sticky material, and it goes on kind of like a Band-Aid. But what I want you to notice on the probe itself is there are two little sensors. So one sensor here at the top and the other sensor here. So the way that this piece of equipment is going to work is like the clamp that goes on the adult finger. These two pieces have to be across from each other in order to work. So they have to be reading kind of like that. So you want something in the middle, what you're measuring, to be exactly in the middle of that. So if we put our probe on, I'm going to use my finger because that's the appropriate size here. So you would take that and wrap it around here, and that little Band-Aid piece just helps that stay on there. So again, if you notice, when I put my finger in here, I've got one side of the probe on this side and then the other one directly across it on the underneath of the finger, all right? Now, with infants, they're gonna have tiny fingers, tiny toes. So we may have to think of another place to put this probe. Once they're bigger, older, our toddlers, we may be able to use fingers and toes. But with babies, that's not gonna give us a good reading. So we have to think about other places to put the temperature probe. So, right, like with this little guy, he's got teeny little toes, teeny little fingers, but I can still use it on an extremity. So rather than fingers, I can use his little wrist. So again, I'm making sure that that probe is directly across one side from the other and attach it like that. I can also use their little foot. So as long as the pieces are kind of pinched together like that and across from each other, I can use the sticky tape to help wind that around. Now, if the baby is moving, these monitors don't give you a great reading if there's a lot of movement going on or if the extremity is cold. So you have to think about that. Feet are nice, are great because you can put a sock on top of that, or you can swaddle the baby back up and leave it there for a minute and kind of do those S's we are thinking about. Swaddle, sway, give them a passy so they can suck. And then when they're calm and still, you'll get a nice reading up on the monitor. All right. So same with older infants, you just have to look at the appendages and what you're working with. Another reason that keeping them warm is really important so you get the best reading that you can. Next, we're going to talk about blood pressure cuffs. Blood pressure is going to be probably the most difficult thing to assess on infants and toddlers, and even sometimes our preschool aged kids. It's just difficult. It's a machine that's gonna blow up, it makes noise, it squeezes, they have to be still and they don't like that. So it's generally one of the last assessment pieces you're gonna do when you're collecting vitals. I do want to show you the different sizes of cuffs. You're probably used to seeing in the hospital the big adult size, kind of standard cuffs. We do have smaller for the pediatric unit. So you're going to choose the size that's appropriate for your patient based on their size. With this little guy, I'm going to use the smallest size I have available. So I want to think about where I'm going to put this on my infant. So again, you're not going to get a very accurate reading if there's a lot of movement. Well, that's difficult when you're working with someone who doesn't understand when you tell them they need to be still. So we have to get them and keep them as still as possible. Also, you have to think about the size of their body. So sometimes the arm is where we think of taking a blood pressure, right? It's where we do it with adults. But if you've got an infant with non-purposeful movement and they're moving around or wriggling around or tightening up, right, that may not give you the best reading. So a lot of times we will think about using their lower extremity, the calf area, and you just think the same way you do if you're doing an arm. Look at your marker for your artery, and you just want to place that near the popliteal. So again, you want to think about different body parts where you can take and measure a blood pressure cuff. With our older infants who are perhaps sitting up or engaged in play or looking at something, we talked about them having very purposeful movement. So their arms are going to be probably one of the harder places that you're going to be able to obtain a blood pressure. So a lot of times if we can engage these little curious hands into something, playing with an item, looking at something on the iPad. So if they have a toy, we can show them how interesting, the toy is and let them play with that. And while these upper extremities are busy and engaged, we can use that lower extremity to get our blood pressure the best we can. So that being our equipment that's going to be a little bit different for pediatrics, heart rate, respiratory rate, and anything you need to obtain using a stethoscope. I want you to think that, again, we are working on borrowed time in pediatrics. So you have to be quick, you have to be efficient, you have to do as much as you can, as soon as you can, in a quick manner. So once I put this stethoscope in my ears and I am going to touch this child with that stethoscope, I want to do everything that requires this stethoscope in that step. So if I'm going in to assess their heart rate and they're nice and quiet, or I've got them swaddled, or I've got my older infant playing with someone and they're distracted, I'm going to listen. So I'm going to start with heart rate or respiratory rate, whichever one is easier to assess. And then I'm going to move to the other. So I'm going to do heart rate, listen to respiratory rate. And then I might also slip down and listen for bowel sounds, because what I don't want to do is use my stethoscope, unwrap them, touch them with this cold stethoscope, go to chart, come back, re-unwrap them, then listen to the respiratory rate, then chart, then come back. You want to do everything you can with the stethoscope while you have it in your hands, because you're working on borrowed time, because they may get upset. It's cold, it feels weird, so you need to do everything you can all at once. All right, another thing that you might see in the rooms that's part of an assessment. Usually this is on an admission assessment, but with infants up to a year old, we're measuring a couple of things. So we're going to see how long they are. We're going to measure their length when they're admitted. We're also going to measure a head circumference and sometimes even an abdominal circumference. So you may see these in the bed. And I think that is all of the equipment that's going to look a little bit different. The next video, I'm going to do an example for you. So kind of a sample walking in and doing a very quick focused infant assessment and vital signs.